that every Kenyan above the age of 18 should make an annual contribution of about 6,000 to the National Hospital Insurance Fund, whether they are working or they are not. That is the NHIF bill amendment conversation that is on. That is Amendment Bill 2021 that has gotten many Kenyans, giving their reactions, weigh in their sentiments on the same, and a majority kind of feel like, this argument is misplaced, because if we are to look into the needs of the common mwananchi, then maybe we'd be pushing them to a level where they are not able to manage. That is not even the factor. The factor then, or the bone of contention then, would be, it's all right, remitting this is not a problem, but just how much more then will NHIF come in handy in the event that I need it? Well, there's one conversation that we'll be having this morning as we get to understand the importance of NHIF at this point when we're talking about achieving universal health coverage, the importance of NHIF, if at all Kenyans are to realize, great care in matters health, or on matters health in totality. And joining me for this conversation is one Yeda B. Machage, who is a senior assistant manager, public education and communication, National Hospital Insurance Fund, that is NHIF. She is here, all stones thrown at her. She's capable, and I'm sure she's going to probably enlighten us some more and get us to a point where we understand, come to a ground where we all agree that maybe it is important to remit some of these monies for the sake of us being taken care of health-wise. In the event that, push comes to shove, at least there's some backup that you would have coming from NHIF. There are few who will tell you that hugely they have benefited from this particular cover, but there are others also who have their fair share of what they would term as disappointments based on how NHIF has served them. And so let's allow Yeda be the person to probably tell us whether we are on track, we are not on track, and whether this bill that we speak about would be instrumental in making changes that will be notable for the sake of matters health in the country. Good to have you this morning.
Thank you.
And here we are after posting that, posting that poster. Oh yes, so on social media, the reactions, I'm telling you, are numerous. I don't even know whether I'll be allowed to go through some of them, but they're pertinent issues that Kenyans have raised, and I think that is positive, because feedback is really, really important. Just how important and of what importance is NHIF to the people of Kenya?
Thank you for that question, Linda. Now going back to what universal health coverage is all about. We are all agreeable that a healthy nation is a wealthy nation.
That's true.
For the simple reason that it bolsters financial protection, lowering financial risk for the citizenry, and also it enhances the engagement of citizens in building in economic growth. Now, the Sustainable Development Goals are arguing all countries, especially countries of the member states, for example, Kenya, to allow, or rather to provide affordable, equitable healthcare to all citizenry at any particular point in time, at any particular place. That is where universal health coverage comes in. Basically, that is actually the definition. Now, we have made small wins in universal health coverage over the years. For example, NHIF, which was established in the year 1966, between 1966 and 1998, even to the year 2018, NHIF, through the Vision 2030, the NHIF Act, the Kenya Health Policy, and of course the Constitution of Kenya, actually graduated from a simple health insurer to a social health insurer. We are talking about social determinants of health, conditions on where you were born, where you live, where you stay, where you go to school, and last but not least, where you work and how you grow old. So NHIF, we are saying, is not discriminatory. Over and beyond that, also NHIF expanded also its benefit design to be able to include what we call primary health care. This is the complete consortium of healthcare, from promotion, prevention, rehabilitation, etc., etc.
Does it focus much on prevention? It's not been so huge, and it's been accused for not being so huge on prevention aspect.
Yes. Now, when you are transforming healthcare systems to align them to strategic purchases for health insurance or for universal health coverage, one of the changes that they have to go through is benefit design. So by benefit design, we are talking about expanding the coverage. As we speak, the NHIF benefits package is actually under consultation deliberation to see how the government can provide what we call the Kenya Essential Package, healthcare package for all Kenyans. It is a package that each and every government desires to provide for the citizenry of the country.
We're talking about close to, I'm sorry to cut you, I'm really sorry to cut you, I'm just asking this on behalf of Common Mwananchi.
Yes.
Close to 50-something years down the line, from the inception of NHIF, why should we trust that another 10 years or another 5 years, NHIF is going to bring something different?
Thank you for that question. That is because, like I said, over the years we have had small wins. UHC did not start yesterday.
That's true.
It did not start last year. It did not start last decade. UHC commenced when the Kenya Vision 2030 realized that social protection should actually be, and the Constitution should actually be an aspect of the universal health coverage drive in this country. Now, the presidency came out strongly. We have had small wins over the years. We may have had some rough starts. You remember our Mheshimiwa Ngilu tabled was it called NHIS bill in Parliament, which was rejected. But the presidency came out strongly in the year 2018 through the 4 agendas to bolster economic development in the country, and said, this is something that I want and I would need to accomplish by 2022. But universal health coverage is transformative. That implies even over 2022 we'll still see changes going on. For example, one of the ways of supporting universal health coverage transformative systems, or rather health systems towards universal health coverage, is transforming or rather increasing their revenue collection. This is basically to increase the physical space for government so that we can say, okay, fine, let the government increase the budget that has been allocated to healthcare, but we don't want it to mess with the economy. That is what we call the physical space. So the government, or through the president, has committed to increasing the physical space from 6% to 15% by 2022 and over 2022. Okay. So universal health coverage is a transformative journey. Yes.
All right. Well, fair enough. Or, looking at the bigger picture and the plans that are underway. We are talking about graft cases. I don't know whether you would confidently be in a position to address this at this particular slot. And before we even get to the aspect of graft cases, lots of issues that have been presented, say by the bill and other policies that you speak of. Do you suppose that the other failures of the government, the other failures of the state, have gotten to a point where they blur Kenyans from seeing the benefits of some of the proposals that are being fronted? If I look at the reactions that we're getting today, most of them are saying, it's all right, forget about that. Why would you tell us to pay for this amount of money? Yet we are struggling to survive. Yet we cannot even afford the household commodities. Yet we are not even able to make ends meet. Where are we going to get money to pay for all this? Do you suppose that some of these failures are coming into the way of what would be a beautiful arrangement of making sure that Kenyans are able to access health?
I think, Yulinda, the beautiful part, I completely agree. What is missing in our health care system is what we call transparency and accountability. This is to imply that the information that is on the ground, what is happening, the beautiful picture, the transformation is actually not being communicated clearly to the members of public. Allow me to take the viewers through what we call the UHC two-phase system. The presidency decided through appointing NHIF as the main insurance model for this country, because it realized in order for us to reform the health system, we need an insurance-based model. So NHIF is actually the catalyst and the primary driver for universal health coverage financing in Kenya. Now allow me to take you through the beautiful transformation that actually happened since 2018. Out of the phased-out approach, we have had phase 1 of the universal health coverage. Then we have also had, we are currently in the phase 2. The phase 1 ran from 2018 to 2019. In this particular phase, we saw piloting of the UHC coverage in 4 counties. I think you're familiar with we had Kisumu, Nyeri, and the rest, etc. What happened within this period? Number 1, there were abolition of users' fees in level 1 to 4 hospitals within those counties. That is number 1. Number 2, we had a beautiful, beautiful stakeholder engagement between state and non-state players. Number 3, we had input financing on healthcare, medication, leadership and development and management programs. We had input financing also on human capacities reskilling. Number 4, we had expansion of facilities within those counties. Number 5, we had what we call the reforms of NHIF. It is a report. The president, through the Ministry of Health, decided to create a task force that would look at the reforms that NHIF had to go through since it had been appointed as the primary driver for universal health coverage in Kenya, so that it can put it as make it a strategic purchaser. Now, a strategic purchaser is a purchaser that makes decisions based on evidence. And also on performance. That is something that NHIF was not doing previously.
Okay.
That is transformation number 1. We are currently in the phase number 2. I forgot to mention that the government also increased the registration of the vulnerables and the marginalized communities, vulnerable households entirely in the country. We are in the phase number 2, which should run from 2018 up to the year 2021, hopefully before 2022. When the presidency comes to an end.
Okay.
What is happening in this particular current phase? We have, of course, the eminent NHIF bill that is already in Parliament. Basically, what we are saying is we are trying to raise revenue in order for us to, from those who can pay, in order for the government to actually afford healthcare for those who cannot pay.
Hold it right there before we even get to the bill and understand some more what the bill speaks about, because Kenyans are not so clear or privy to this information. And you know, sometimes they say a lie, you know, told a couple of times becomes truth, and therefore we need to have, you know, this information demystified and, you know, well articulated to the people. Let's come to the practicability of it and the fact that we acknowledge that there's been so much in terms of reforms that have been witnessed, that is in the NHIF side. But do you suppose that the practicability of the same is being felt by the common mwananchi down on ground? Do you agree that the vulnerables are now able to access healthcare better, you know, courtesy of NHIF? Would you agree with me if I told you today that, for instance, as Linda, I have one patient in hospital and this patient has been struggling, yet they have NHIF, and every month we have to pay for the same. But then again, when it comes to accessing services, there's always a stumbling block. There's always something. There's always an excuse. There's always a reason as to why they're not going to get that funding. And therefore, you have to go back to your pockets to fund this, and then you're told, well, this is because the NHIF procedure will take forever, and you know the patient is at a critical position, and all these processes. Do you agree that there's some level of mishap that, you know, is being witnessed between the people who are accessing these healthcare systems, and I mean generally the fact that we have these policies that are considered to be progressive in NHIF?
Thank you for that question, Lena. Now, in the road to universal health coverage, what usually happens is, number 1, a citizen or rather a country must recognize the universal health coverage goals. Number 1, financial protection. Financial protection is where we need to assure that a member, or rather a citizen of the country, does not have to sell that land, to sell that car, to sell, you know, to go over and beyond the income level in order for them to be able to afford healthcare. We call it catastrophic expenditure. Number 2, we need to make sure that we do not push healthcare expenditure, does not push the citizenry below poverty level. We'll call that impoverishment. That is number 1. So basically, and then number 2, equality, to make sure that all Kenyans are protected and they can actually afford healthcare. We were talking about promotive, etc., like I mentioned earlier on. And I actually mentioned that the benefit package is actually going through right now through some enhancement and transformation. Then third but not last, we need to make sure that there is quality in healthcare. That is to imply the healthcare that we provide through our purchases is actually consistent with good medical practices, let alone now the universal health coverage goals. Number 2, we need a healthcare financing policy. What are we talking about? Under the healthcare financing policy, we are talking about revenue raising. We're talking about purchasers. We need to expand the services that we provide. We need more purchasers on board the healthcare providers. We are talking about the pooling aspect. Right now, the Kenyan system is very fragmented. We have voluntary contributors, mandatory contributors, etc. We want to bring sponsored programs as well. These are programs that are sponsored by the government and also by donors. We need to bring them into one pool because under the UHC principle, when you pool, it is very easy to also redistribute. It develops an efficiency. We are talking about service delivery as well as the aspects that NHIF, the transformation that had to go through in order to bolster also as well its performance as well. Number 3, we are talking about context analysis. This is now where the big question comes in. You have raised very pertinent issues. Before the presidency agreed to actually take, or rather when he agreed to actually take this, make Kenya go through, or rather to achieve universal health coverage, a few things had to change. The presidency plus the team, like I told you, in the phase 1 had to go down on the drawing board and understand where the gaps are and how they need to be filled. So this universal health coverage is transformative, and yes, it is actually achievable. Only if a country decides to make a strategic decision, which the government did by saying we need to actually have an agenda on universal health coverage, and also the commitment. A lot is happening on the ground, like I mentioned earlier on phase 1, phase 2 of universal health coverage, inclusive also that we also actually have 1 million more vulnerables as at last month registered through the national registries under NHIF to try, as we are trying to we see on how to upscale universal health coverage as well. So it is a beautiful picture that is taking place. What I said earlier on is we need to inform. That is a gap. We need Kenyans to actually know what is happening on the ground. There is a very beautiful story which needs to actually come out for everybody to appreciate.
That's true. Let's speak about the bill that has raised lots of controversy. And just looking at the feedback that we get, Kenyans are like, no, 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 no. They will raise the issues of COVID-19. They will tell you that we are breeding a space for corruption to happen. And that is one thing that is really crucial. Just what would be this one thing, 2, 3 things that are incorporated in the bill that will be a take home for Kenyans, that will be instrumental in transforming this sector? All right.
Thank you very much for that. One of the first of all, I would like to appreciate Kenyans because I realize they are actually paying attention. I would also like to bring to the attention that the bill has been open for public participation.
Yes.
Let them make sure, each and every one of them, that they actually participate. And this journey starts tomorrow. So they should actually intentionally make sure there are active participants in this process. Yes.
Okay.
Number 2, going now to this beautiful thing that will actually happen through the bill. I feel, like you said earlier on, sometimes we become very selective. We choose to read this particular part. We fail to read that particular part. We also have what we call enhanced benefits. A member would actually be able to enhance their benefits through voluntary contribution. Yeah, that is number 1. Number 2, we have the revenue raising aspect. In the year 2018, 2019, NHIF went to a very difficult stride. We lost active contributions, or rather active membership, all shot up to 12%, then went down to 9.5%. Remember, the mandatory contributors must pay through their payrolls. So what we are actually looking at is a small chunk of the population, which is made of the informal sector, the voluntary contributors, and the donations coming in. So we actually lost on those 2 fronts. So, and then also in the very, very same year, the claims benefit ratio was at 100%. The claims benefit ratio is a ratio that shows how much revenue that has come in versus the claim benefits that have actually been paid. It was 100%. That is why the president instructed a task force to sit down and, come up with solutions on how they can actually sustain NHIF. Because NHIF, as at this particular point in time, as well, has the most membership, is the most reliable and widely covering insurance in Kenya. So if you lose NHIF,
they will tell you it's because it's more of a mandatory thing, and therefore they have no choice but to be part and parcel of it.
All right.
But and then they will argue that maybe they do not get much of benefits out of it. They struggle. I had a conversation with one of us in the morning, and she said, that time that I was going for maternity, I was told that it's only going to cater for the bed. And so I asked myself, what was the point of me paying NHIF for all these years for it to only come and cater for my bed? And some would even argue, I would rather that it doesn't help me, but it proceeds to help a person who's in dire need of it. But such is not what we tend to witness. I am yet to probably see. And like you rightfully put it, there's need for people down on ground to understand that, well, this has helped, this and so and so. Someone can confidently come out to say that, courtesy of NHIF, close to everything has been catered for. Courtesy of NHIF, I have rightfully not had to go and sell my land just because I had a sick person at home.
Yeah. Thank you. Very, very important. Now, one of the transformations and reforms that NHIF had to go through is, I want to answer that question on the maternal care for the insured that you actually had a chat with about. Over the years, NHIF has transformed its benefit package. In the year 2015, NHIF would only boast of 2 to 4 benefit packages in the entitlement. Then we came to this much hyped flagship program called Super Cover.
Okay.
Do you know what Super Cover is all about? Super Cover is the revamped old package system. We have a new benefit design. Under the Super Cover, you can actually enjoy 11 benefit packages.
Okay.
We are looking at inpatient package, outpatient benefit, maternal care, very, very important, kidney treatment, surgical treatment, cancer treatment, foreign treatment, rehabilitative treatment. That is something Kenyans don't actually know, that NHIF caters for mental
Will it be
cases.
misplaced to say that NHIF has not done so much of civic education for people to understand the benefits that are there? Because I'll tell you for free, the kind of, troubles that we meet when we get to hospitals.
Yes.
Yeah. And the image that we carry here is not the image of the hospital. We carry the image of NHIF. When, like, what, I had my NHIF card, I went to this place, they really frustrated me. NHIF at ISID. Hold it right there. We'll come back after this short break.
Precast panels. We have the best quality, durable and affordable precast panels to suit all your needs. Manufactured under a controlled environment, we have the best precast concrete panels, precast concrete floor slabs, precast concrete perimeter wall, precast concrete columns and beams. Our panels reduce construction cost by up to 40% with absolutely no plaster required, including added soundproof benefits. Convenient for story buildings, schools, offices, residential houses, hospitals, and warehouses. Take advantage of our free transport. Contact us on 0702 24 7267 or 0796 24 7267. Global Precast Panels Limited, your reliable option for efficient construction.
These are the sights and sounds of a working nation. There are no shortages to remarkable ideas. What's missing is the will to execute them.
You need to stay relevant. If you don't, you're going to fade off.
Yes, they are a dime in a dozen, but the real meat on these bones comes from trying to realize them.
You just need to perfect anything. If it's drawing, if it's music, pursue it 100% because it's something that is giving back.
Join me, Violet Njoki, as I tell you the stories of these executed ideas, because yours could be next. Mondays, 7:30 p.m.
Hey, now that's hitting the right notes. When life gets boring, we bring out our play. You see, playfulness is in our DNA. It's in the way we move and laugh. It's in the way we walk, the way we rock, and how we just don't stop. You feel me? We add color to everything, to every day and every dish, because the world needs our crazy. We're the different flavors that make life more exciting. We're the ones who add color to every moment. Fanta, color every moment.
Well, the speaker is neither here nor there.
I should have done my outro from here.
Yes, no.
And we're just like that. I look beautiful.
Tune in to Morning Cafe, Mondays to Fridays from 6 a.m. to 9 a.m. with me, Linda Alela, only on TV47, the home of Untold Stories.
Let's go beyond, let's go
welcome back to the broadcast. We still are having this conversation. I will use her name Machage, but I'll say that Yeda, right?
Yeah,
Yeda is a very beautiful name. I was like, Yeda, is it Yeda or Jeda? We never know.
Yeah.
And we're still with her here as we ponder some more on understanding the NHIF. She represents the face of the NHIF, and therefore we throw all the stones to her because there's that general feeling that there's more that NHIF can do that it is not doing. And to be honest, we cannot always just label it bad. It has worked for very many Kenyans. It might not have worked for you. You might not have gone out of your way to probably access this help, but there are individuals that have hugely been helped by the same. And brings us to the question of civic education. Just how much are you knowledgeable about some of the covers that are within the NHIF that would be helpful to you? Because sometimes we pay, yes, but we do not know whether it will be helpful in this quarter or that. And so therefore we end up, going out there for fundraising, going out there to call on family to come in handy. Yet NHIF could come and maybe cater for that particular trouble that you're having. So civic education.
Thank you, Leader. Zooming into the very important question. Now, one of the reforms that NHIF had to go through, remember, let me take you back a few steps back. Back to phase 1 of universal health coverage. One of the points that I had actually mentioned was NHIF had to go through some reforms, proposed reforms, in order for it to be right place as the strategic purchaser for universal health coverage. One of the reforms that, or rather the gaps that were identified by the task force that was itemized by the instituted by the Ministry of Health on NHIF is public education. Yeah. And communication to the public. Then what did NHIF do? NHIF went ahead and actually instituted a department specifically for that particular activity. What is happening at this particular point in time? NHIF is working closely with national governments, with the county government, with the Ministry of Health, to actually make sure that the benefit entitlement and any other communication is disseminated. Additionally, NHIF has gone over and ahead and forward to also work with non-state stakeholders. For example, TV47.
Yeah.
Yes. So we are bolstering public education and communication. It's a gap that was actually identified as one of the reforms that we need to do, and we're actually doing that. Number 2, studies have shown that more Kenyans now are tech savvy. They own mobile phones, and they can access internet. I would like to ask the viewers today, are you on Facebook? Did you like our page? Are you on Twitter? Did you like our social media? Do you have internet on your phone? Do you have the NHIF app on your mobile? Those are the questions that we need to ask Kenyans. Because without this particular, or without them absorbing these instruments, then it will be very difficult for us to actually fault. We are actually putting transfer instruments for them to actually be able to access. It is also for them to respond positively, adopt these apps that we are putting on. Do you know that NHIF has a toll-free line?
Right.
0800 720 601. Dial at no extra cost. This is information that Kenyans do not actually know. Our website, it is enhanced. You can get the hospital providers and healthcare providers on it. You can get the super cover entitlement information on our website, and amongst many others. Our customer service system is now 24-hour operational. Call at midnight, somebody will pick. Call in the morning, somebody is actually going to pick. We have expanded our network of providers. From the year 2018 up to now, we have done 100%. 4,000 to above 8,000. We have also expanded our service centers. We are talking about over and above 100 service points countrywide, inclusive of Huduma centers, satellite centers, and branch offices. So these are the beautiful, beautiful stories that we have down at this particular point in time to actually be able to expand the purchases that we have, the benefit design we have expanded, but also communicating, revenue raising, of course, also the communication out there as well, and the pooling effect as well. Now it brings me to a very important question that you asked earlier on. Okay, this member says, well, I have been paying NHIF, I have never used my card before. So where is the money going? Remember, NHIF is operating on what we call the social protection mechanism. NHIF does not discriminate over and above other insurers. NHIF will not say no to you because you have a chronic illness. It will not say no to you because you are a pre-existing condition. NHIF will not say no to you because you are 80 years old. No, It will not say, no, you cannot only register 3 dependents. No, we don't operate like that. NHIF will not say no to you because you don't have a consistent, you are on a contract, you are not permanent, you don't have a consistent level of income. It will not say no to you because you're not a resident of,
but it will say no to you if you don't contribute.
It will not. It will say no to you if you've not contributed, if you can contribute.
Okay.
Remember, we have a very special group of persons called the vulnerables and the marginalized households. How do they enjoy healthcare? The government through NHIF has actually registered, as at May, an extra 1 million vulnerables in the system.
What goes into, you know, picking these vulnerables and knowing that, well, these are people who are not able? I mean, age would be automatic, but what of the other Kenyans that probably would not be aged, or but they have their few various challenges that would, you know, require that they are covered. And I mean, they would be considered as this category of you know, vulnerable. So what is the process of?
Well, thank you for that question. Now, currently, under the Social Protection Scheme, NHIF has implemented 4 of them. Number 1, we are talking about Health Insurance Subsidy Program, which covers the children who are vulnerable and any other vulnerable member of the community. These ones are identified by the national registries. That is number 1. Number 2, they are also identified by the non-state actors that we have in the economy. For example, maybe a donor organization. They actually have their pool that they can actually identify. And the beautiful thing is, NHIF does not say, okay, fine, this is not government revenue. No. NHIF is actually saying we are trying to actually encourage, or rather, NHIF is encouraging donors who can actually upscale their support to the vulnerable in society to do that. Number 2, we also have the elderly, the programs for the elderly. And number 3, we have the program also for the disabled, extremely physically disabled. And then last but not least, we also have a program for the expectant ladies who cannot afford healthcare. And you remember, this one spans all the way even to below 18 years of old, because we have our children, our nieces, you know, the girls in school who actually bear children at a very young age. So the government is saying that these are groups that experience out-of-pocket expenditure slightly more than the rest of the population. That is how they identify them through the national registries. Last but not least, we have the Edu-Affair program. This is a program, a free health care financing program for students who are in government schools. Vis-a-vis the ones in private schools, you will realize they also have their challenges, these children. Maybe they come also from impoverished backgrounds, and the parents cannot afford health insurance. What do we do to actually sustain that child and keep that child in school? So NHIF over and beyond healthcare is also going, focusing on also other areas like education, empowerment, economic empowerment, maternal health care, and the theme here, the main message we're actually putting out there is, we are not leaving anyone behind.
You know, I came here guns blazing. I was hoping that I'm going to hit you so hard, but I realized that in that process we might lose on so much information that will be very important. Listen to what it is that we're getting this morning. It could be helpful to you, and make sure that you also tag somebody else and share this so that at least somebody else can get to benefit of it. But just to come back to, you know, in defense of the common mwananchi who probably could not be on the vulnerable side, but, you know, remit their own monies every other month just to cater for this, has probably put the names of, you know, their immediate family members under this to be catered for. I just don't understand what gives into, you know, the agreements of the hospitals that are supposed to, you know, of course, front this and make sure that the patients that come there can be able to, you know, access medical facility, the facility, you know, under the NHIF cover. Because I'll tell you the level of mistreatment that goes into that, and I'll tell you the level of which, you know, you go there and say that I'm going to use my NHIF card. It appears as though you're just a nobody. I don't know what goes into making sure that there's an agreement of protecting the persons who are the taxpayers, the persons who are paying for this, services of NHIF, because then they are your employers, and therefore they are the bosses in this case. What goes into, you know, agreements of making sure that they are respected, they are well taken care of, they, you know, access the cover as expected? Because I speak of a scenario where, you know, the other day I know of a family that, you know, had selected a certain hospital in Nairobi, and then all of a sudden this hospital wakes up and, you know, they are sent for messages that, you know what, you have to find other hospitals from nowhere. And, you know, you're trying to look at a hospital that is close to you, proximity, and, you know, all these other things.
Very important.
What happens in such a scenario?
Thank you for that question. Now, like I earlier on mentioned, NHIF through the HEPREP report has embarked on enhancing the customer care experience. That includes expanding its networks, which borders on healthcare providers, on our outlets, outlets that we have within us, and also digital transformation. Now, going back to the outpatient package. The outpatient package is based on what we call the capitation model, where your benefits as a member of NHIF have to be tied to a particular facility or healthcare provider for a period of time before it is revised. But the good news is there are exceptions to this particular rule. Number one, for example, what you mentioned. What happens when I wake up in the morning, then we realize for one reason or the other, this healthcare provider has been disempaneled by NHIF. Number two, what happens in cases where I say, for example, there are emergency cases where, say, for example, I live in, we could say, Buruburu. Then I traveled for an engagement in Langata. Then an emergency happened. The case number three is, ideal number three is, I traveled out of my place of where I'm domiciled, say for example from Nairobi to Kisumu, then I experienced an emergency. There is also another case where I am transferred because of work-related issues, or I move from one city to the other. There are actually exceptions. We consider that emergencies happen, and we could actually change that particular outpatient care at that point in time. We have digitally transformed. Call that toll-free number. Write that email. We have like a few emails now. customercare@nhif.or.ke, customer complaints @nhif.or.ke. You could do that. You could visit any of our branches countrywide, the networks. We have over 100. You could text us through your NHIF app. Text us through the USSD *155#. So, like again, I was also saying earlier on, is as much as we are creating, we are trying to enforce one of the intermediary goals of universal health coverage, which is transparency and accountability. We need member participation. Take control. Now take control of your account and your rights. The right to healthcare is a right that has been indicated through the Kenyan Constitution. We need people to actually be proactive in this process.
All right, probably I'd want to believe that answers the questions of one Mukoya Iwa who's watching us from Lindi Kibra. This is what he says. Thanks for the healthy conversation on NHIF. My question, if I have never changed the hospital, no checked for update, but I always pay every month, will I be denied services through the NHIF in hospitals?
Thank you for that question. Probably I would like to understand why the member feels he can be denied. Because as an employee, automatically, it's called automatically contribution, mandatory contribution, we receive your contributions. But it is also prudent for the member to confirm through our digital apps, the self-care apps, whether that employer is actually remitting the contributions to NHIF. It is very, very important, because we have had cases where, deductions have been, but they have not been remitted. So take control in your hands, dear member, and actually confirm from your account whether everything is okay. As long as your profile is fine, your contributions, you are compliant, then you should not be denied any service at any particular point in time.
Let's have some level of understanding, some bit, like 2-3 minutes of understanding what is expected of one, when of course they are expecting that the employer has remitted all these finances and all that. So this is the day you've gone to hospital and home, you might need to access some finances, and therefore you think NHIF. What are some of the key things that would bar you from accessing this, if at all you've been making your contributions on a monthly basis?
Okay, thank you very much for that question. Actually, that question is key. NHIF recently rolled out what we call the biometric registration system. I think you have actually said it.
That would have been part of this conversation, definitely.
Yes, dear member, have you biometrically registered yourself? We are trying to protect your account. We are saying nobody else should be able to access your account, make changes to that account, and use the financing which is within the system and in your account to ensure NHIF is sustainable for you and for the other person who can actually not be able to pay when you're not using your contribution.
Is that to render the cards useless? Somehow, yes.
Yes, yes.
And, and convenient.
It's not really to render the card useless, it's to make the process user-friendly, because we realize sometimes the member may not have the NHIF. Of course, eventually, we might actually rather accommodate what we call the smart cards.
Yeah.
But this particular process is to make the services user-friendly. You can go to the hospital, not necessarily with your card, but with your ID card. And then also, the other challenge you had previously was the dependents have to actually go to the hospital with your physical card, which is not very practical. Yeah. So you see how we are actually enhancing the customer experience on the ground. We are saying that your dependents, when you register them into your account, can actually go and just do doop. You don't have to have daddy by you. You don't have to have my husband who has the NHIF card by you. No.
Do you have to carry your birth certificate? Because recently I've been treated to that, where I had to carry my baby's birth certificate because he would not access healthcare unless I had the birth certificate. And you know, the birth certificates are the documents that we hide underneath, so at least we protect them. So imagine that scenario.
Now those are the reforms that we're looking at. We want to make this experience very user friendly. One of them is by limiting actually the manual processes and the documents that you have to carry with you to hospital. Now what the biometric reforms right now, what the exercise is doing is, in order for you to actually be able to do that, sometimes there are situations where you're maybe far away from the biometric, whatever is it called, registration point, and you want to send your children. You could actually send your children probably with your ID, and they will also need identification documents. You see, so what some of the documents that might be required, as we're actually looking at phasing out the manual, making this experience user friendly, is copy of your ID or copy of your NHIF card. If you're a spouse, carry your ID card. If you're a children, you could carry your birth certificates, and maybe the ID card or copy of ID card of them as well. So those are the things so that one of them is biometric registration. Yes, so we are telling members to actually go on biometric card and register themselves. Yes, at this particular point in time. Yes.
All right, so this means then they should visit any NHIF branch so that they can have that process done for them.
Yes, any NHIF service outlet should be able to enhance this process for them. Yes.
Any other spots away from that, away from the NHIF offices?
We have Huduma centers, and we also have some hospitals countrywide.
All right.
Yes, which are also right place to also provide that service.
The process goes on until when?
The deadline is 11th of July.
Oh my goodness.
Yes. So in order for us to protect you Kenyans, please respond, protect yourselves. Go and biometrically register. Yes.
Okay. That's interesting. We need to take note of that. Yes. I hope you do, so that you're not locked out of this very important process. I know there's nothing much we might not have much time to go deep into understanding the bill or go deep into understanding this process of biometrics. It's important that you just get to visit any NHIF branch around you so that you can get information about this. Or maybe there are social media platforms like, of course, Chagi would rightfully say. But the aspect of corruption, it will be hard for us to understand that you're saying, you know what, this money is a channel towards helping the other Kenyans, social, you call it social what?
Social protection.
The social protection aspect. Yes. At a point where we hear cases of corruption. I don't want to put you to task to explain so much about what has happened in the past. We still know that there are cases that are pegged to NHIF up until today. But just what is being done to seal the loopholes of the same. If we are sealing the loopholes of making sure that at least we will not have other individuals coming to use someone's account and all that, then we as Kenyans would as well want us to, want you to probably give us the confidence that there's not going to be graft, there's not going to be corruption. And therefore, even if I am to contribute and I do not use the money, I'm confident that another Kenya is being held, or another Kenyan is being helped by the same amounts that I have contributed. Otherwise, if we talk about corruption today, then it's going to be a worry. So how do we seal the loopholes within to address the aspect of corruption?
Thank you very much for that question. Now, two of the core values of NHIF is, number one, we are out to prudently make sure that resources are prudently utilized. And number two, NHIF is out to actually make sure that we protect the interest of the stakeholders. Number three, NHIF has also one of the reforms also promised, or rather is in the transformative process to make sure NHIF is a corruption-free zone. You may have realized that on the media, I think maybe some of our viewers might actually read stories and did articles, one or two, on how we are actually transforming the fraud process with regards to healthcare providers who, for one reason or the other, maybe have a dissent that had not, maybe the contract we have between us and them have not observed it to the latter. From January, we have taken a few cases to court. That is out for the public to actually see and hear. Number two, NHIF has also introduced, or rather is in the work of introducing, a forensic and system security department within the structure.
Yeah.
Number three, we have also digitally transformed with regards to enhancing service delivery and customer experience. We have a toll-free number that you can call anytime. We have a direct email through which you can actually also report fraud cases. So these are the changes that we are actually seeing within the structure of NHIF. Yes, as we work also with both state and non-state stakeholders in the country.
Caleb, I hope you're on. He missed on the places where he would go for registration of the biometrics. I'd say, well, the NHIF offices and specific hospitals. Maybe to be specific, what hospitals would we be looking at? Could you be having details of these particular hospitals that probably one can match into and get registration processes? Or it's best that we advise them to go to NHIF offices?
Number one, go to NHIF offices. Also something that I also needed to let member, the fourth point actually on the fraud line.
Yes.
Is together in liaison with the biometric process, we have also introduced what we call the e-claim process as well. We have also digitally transformed our claim system. Yes, so everything we will not have manual. And you see, the beauty with the digital transformation is fraud cases actually, we lower actually fraud cases. Yes, we are more efficient, and we are in terms of governance and oversight, we transform the process.
That's true.
Yes, so I would like to confidently let members know that fraud is fraud detection, and also what is it called? Addressing fraud is actually at the front line of the National Hospital Insurance Fund. Yes.
All right, let's remind him of the places that he goes to, because he says he missed out on that.
Oh, you can visit any of the branch offices countrywide. They should be able, or the satellite offices or the Duma centers, they should be able to actually let you know which hospitals have already come on board with the biometric registration. But what I can say is any hospital that is closest to you should be able to register you biometrically.
Okay.
Yes.
All right. Thank you so much. There's still so much that we'd love to touch on, but then time would not allow us, and therefore I'd love for you to give us your parting shots on the same, on this conversation, because it's been quite a lengthy conversation. But I think what we pick is that there are a lot of things that NHIF can do for us. It's just that we probably are not privy to this information. And interestingly, you march into a hospital, they'll not give you those options. They'll just keep silent.
Right. Now, something that I would like to remind Kenyans is NHIF, unlike any other insurer, is a social insurer. The vision of NHIF is to be a universal social health insurer of choice. Not the word universal, not the word social. Universal, whereby we want you to be able to actually enjoy health care at any particular point in the country, anywhere, at any time. Number two, social health insurer. We would like you to know that we are governed by the principle of pooling. The principle of pooling is where the young aid the old, the high income, the high income aid the low income, and the ones who are well, they aid the ones who are sick. I would like the viewers today to realize all this, especially the NHIF bill, the reforms that NHIF is going through, also in consultation with the national government and county governments. It's for the good of everybody in this country, because our theme is leaving no one behind. The poverty index has indicated in the country that the poverty levels in Kenya are actually on the high. What happens to that person who cannot afford healthcare? Where will that money come from?
That's true.
Yes. So I would like Kenyans also to be able to envisage and also accommodate the spirit of oneness. Let us transform Kenya together as we look forward to making healthcare affordable, accessible to every particular Kenyan in the country, for those who may be able to pay, not necessarily use their contributions and their financing, and also for those who may not be able to pay for healthcare.
All right, Njoroge case is a good way to wind it up, but please do not force us again to make the payments. Some of us really would wish to. but well, the tough times would not allow us to do the same. That's an interesting one. I guess it's a reaction on the bill. Thank you so much, Yeda Machage. Yeda Machage is the Senior Assistant Manager, Public Education and Communication, National Hospital Insurance Fund, that is NHIF. It was good having you, and thank you so much for the great insights that we pick. Please make sure that you tag your friend as much so that they can get all this crucial information on our social media platforms. # Morning Cafe at Linda_Alela TV47 KE, and that is TV47 Kenya across all the social media platforms. It is important that we learn of these great things that are available, or as well, let me, blow their trumpet for a second. Visit the NHIF social media platforms. It is for your own good. It was good having you from the White Girl, and we close it at that. A beautiful week ahead is all I can wish you, as I look forward to see you again tomorrow. My name is Linda Alela. Once again, the program Morning Cafe winds up at this particular point. Bye-bye.